So good evening, everybody. Those who are joining in the Zoom meeting and as well as those who are joining on YouTube Live. This session specifically I'm taking because I received like some students' query regarding the various difficulties you face because of the preparation, or you have some doubts, or you have some problems which you're facing when you are preparing for NEET SS or super specialty exams, or you want to prepare for both the MS exam as well as the super specialty exams. So that is the reason I'm taking a session. I have taken in the questions which you have asked from the students who have registered, and also the just wanted to tell you that the live video may be lagging. So in case you have some doubts or queries, please write in the chat box, and don't worry if they are answered with a delay, but they will be definitely be answered. So I have taken some of the questions and I'll be touching upon them, and then I'll be taking your queries, whatever you have. You can be free to ask whatever you want to ask. I'll be happy to solve them. I want to help you because what I faced is that many of the students, they don't have adequate support, they don't have adequate help, or they don't know basically how to deal with the pressures, how to deal with how to prepare so much with the stress which is involved. So the basically what issue many of the students face is that they might be able to study properly, but they may not be able to retain. If they're able to retain, because of the anxiety, because of the stress, they tend to forget. Or sometimes because of seeing peers performing more or performing nicely in the mock tests organized by various platforms, some students face a lack of confidence. Some students face the difficulty of planning. Some students face the difficulty of managing work and time. So there are many multiple questions which I went through the phase while preparing, while seeing others prepare, and also the similar questions that I have got from you guys. So the first and the foremost question which I got was regarding the dates of NEET SS. And to be very frank, the only thing which I can tell you regarding this is that all must have seen the circular from the NMC regarding the dates of MS exams. From their asked everybody to give their dates for the various universities. And as the 2020 batch was also delayed, so we can expect that this year NEET can be anywhere from July to September. That is what I'm expecting, and not early July, but I'm expecting mid to end July, but not before that. That is the hope, and that is the calculated thing which I can tell you. But yes, I cannot be sure regarding when can we expect this. This is just a probable window where I feel that it will be there. I don't expect it in June also. May, June is not in question, because many of you are having your MS exams in the end of June or July, or even in the end of July. So probably I feel my personal opinion is August, but it can be in this window of July to September. But forget about this. Now you have 3 months, understand? April, May, and June. Just consider these 3 months. If you get more, it is obviously added advantage, but think yourself that you have 3 months right now for the exam, and prepare and plan accordingly. Next, what I was asked regarding is 4 months enough to prepare? What I would say is a big yes. Why? Because I feel that as the syllabus has been now restricted to these two books, I feel that it is definitely enough. And provided that you have read properly during your MS, not just both the books, even if you've read one of the book, or you have covered partially some of the portions from Sapiston, or you've read daily, I think it should be enough for like you to read properly. And that should be sincere reading. It should not be like haywire reading. It should be very planned, sincere reading. Then I think 3 to 4 months is a pretty good time for you to prepare for NEET SS. And now, because of the syllabus being restricted to the level of PG exit, and also the syllabus being restricted to certain number of books, I expect you to prepare nicely in this period. And also the other thing is that because they've started asking more clinical based scenario questions, I feel that if you have worked properly in your MS, if your clinical concepts are clear, then I think you won't be facing any difficulty in cracking NEET SS. That is what my personal opinion is. Now, the most important question, what I have selected few questions which I got because I felt that these are very important for us to cover. Now, regarding your management and balancing your work as well as study. Now, I know some of you must be working, doing a job, or some of you would be doing an SR-ship. Some of you would be in the final year of your MS, preparing for NEET SS. Now, from a personal opinion, I also wrote about this in the blog, and also my personal opinion in this is that whatever time you get in a day, even if it is 4 hour, 6 hour, or 8 hours, the best if you're working in an environment where you get time to study, whatever time you get, the important thing is not to see if you're getting 4 hours, 6 hours, or 8 hours. What I feel is that one thing, you have all of the platform MCQs, not just ours, but every other, whatever you have taken to prepare for your super specialty exam, they're all available in the apps to solve the MCQs. So what I personally did was that when I was working or in the ward, or when I'm waiting for the round, or I'm waiting in between the theater, if I get some time, either like it is not difficult, it is not easy for everybody to carry their iPads or something, you have the mobile. What you can do is you can just open the questions, you can just go through as a reading, don't try to solve it in that time, just go through and read the MCQs in free time, like in the workplace. That is one thing what I used to do. Second thing is that after you come from work, you have some time to relax. Then if you are coming, for example, you're working 9 to 5, you're coming in the evening, you like relax yourself for some time, then whatever time you have, divide that divide that into slots of few hours, or divide into slots of 45 to 50 minutes each, and study with full concentration in that. That is more important. Don't think you have got 4 hours, 2 hours, 1 hour, 3 hours, 5 hours. Don't think that. Think that whatever time you have, I'll just whoever is joined, please kindly mute yourself. So sorry for that. So what I was saying was that whatever time you get, even if it is a few hours, even if it is 1 hour, half an hour, 45 minutes, study that. Make your schedule, whatever you have made, make a schedule of either 1 week or 15 days or 1 month. And if you are working, then restrict your schedule in such a way that you keep less, but not even so less that you are not able to complete in time. But don't overburden yourself, especially if you are working. Because what will happen is if you're overburdening your schedule and then you're not able to complete it, you will feel that you're not able to, you'll be lagging and you'll be low in confidence. So rather than that, take a little bit small topics or restrict yourself, your schedule, so that you can complete it easily and you have few days to spare. What will happen is that your confidence will be boosted. So by that, what will happen is that whenever your confidence get boosted, the next thing whatever you are supposed to do, just not about studies, but even if you're in your practice in your life, what will happen is the more confident you are, the more efficiently you work. If you're low on confidence, your efficiency goes down and you go into that vicious cycle. More confident you are about your preparation in terms of, if not just about the memory, but even if you're able to complete your schedule, that you're able to read, you're able to solve certain MCQs, you are able to do certain things which you thought that you will be able to do it, then your confidence will go high and the efficiency will increase. The confidence and efficiency has a direct correlation. That is what I feel, and that is the utmost importance. So managing work and study, it is always your personal perspective. But other thing is that does not matter the time which you get. It is what time you are getting, how you're utilizing it. Quantity is not important. Quality of studying in whatever time you get is important. So that is what I feel you can do to manage your work and study. Think that if you have the option of leaving the work and you feel that you will be able to study properly with leaving your job, then that is a different decision. If you think that you have no option but to work and prepare simultaneously, then don't think while working that I'm not studying, I'm wasting time here. Your both studies and your work efficiency will be affected. So during work, concentrate on that. If you get free time, do some MCQs, read some articles, read some topics in your mobile, whatever you have. Then when you get the time to study, concentrate on that and do it with the quality. Now, planning and consistency in preparing. Some of you asked regarding this. So one is planning. Now for this, what I feel is that you should be aware about your drawbacks, what topics you're lacking, what topics you need to be like reading multiple times, what topics you can just revise, what topics you have not read. You should be aware about what your preparation is, how much you have read, how much you have not read, and then you need to plan. Third thing is you need to be aware about your speed. If you are reading with your friends, don't compare that he's reading one chapter in a day, you're reading half a chapter. You don't make your schedule to compare with your co-colleague. Make a schedule, plan your day, plan your schedule in such a way that it matches your speed. If you try to match others, you will always fail. So try to make your schedule, plan accordingly in such a way that you cover all your drawbacks, you cover what you are lacking, what you are not reading or you're not read, and also covering what your strengths are, and then you plan it. So you need to sit down and divide what your strengths are, what your weaknesses are. And what does it mean in our syllabus is that what you have read properly and what you have not read. Second thing, what you feel that you need to mug up, you should understand that it is a weakness and that you need to read again and again. Strength should be that what you have read and you are thorough with that topic. So that is what you need to first understand. If you know that, then planning will become very easy. You need to understand all of these things. You should be aware about your preparation. You should be aware about your drawbacks and understand your speed. How much time does it take for reading one page, one topic, one chapter, one part of the Bailey or Sabiston, and then plan your schedule accordingly. Next, consistency will come if you are able to mark how you are going about your schedule. So what I used to do was that I used to make a schedule of 5 days. I used to do in the ratio of 5:2. I used to read, keep the weekdays. I used to divide the topics for the weekdays and keep free time in the weekends, not for relaxation, but covering any topics if I'm not able to cover in the weekdays. And then what was happening was if I completed my quota in the first 5 days, in the 2 days of the weekends, I used to revise them. Or if I feel that I am feeling bored regarding reading that topic again, I used to make the schedule for next week and I used to restart the schedule for the next week within the weekend. So what will happen is if you're able to complete that, then your confidence will come, your efficiency will come, and then your consistency will start coming. And what I feel is that certain times what students do is like if you're working 9 to 5, you're getting time in the evening, you're getting limited time. So you go beyond your limits and you keep a schedule and then you do not stick to that. You start lagging, your consistency go down, your schedule goes haywire. So as I told, your planning is most important. If you plan very properly, efficiently, consistency will automatically come up. Make a short schedule and then extrapolate it into weeks, months, like that. Because if you make a schedule for 1 month, at the end of 1 month you may be lagging, you may go haywire. If you make a short schedule for a few days, or for even if you want to make a daily schedule, that is enough. Make a schedule in the night for the next day, read from morning to night, see how much you're covered, how much you're lagging, make the schedule for next day accordingly. So that will help you to be consistent. If you make a pretty long schedule, like in 1 month, I'll complete this portions, If you do not, your consistency will go down, your efficiency will go down, your confidence will go down. So that is what I feel for planning properly is the important key for consistency and also quality. Next, how to manage time. Now, this is very important because now we are not a school going student that you need to make a schedule that 8 to 9 I'll do this, 9 to 10 I'll do this, 10 to 11 I do this, 11 to 12 I'll do this, I'll take lunch. That all things is not needed now. What I used to do was I used to divide my day into morning, afternoon, evening, and night. So what happened was I used to make my quota that in morning I'll try to cover this, or as I was preparing without working in the last 2 or 3 months, what I did was after waking up when you are very fresh, I used to do either two things. I used to solve MCQs and not solving in terms of like giving like exam. I used to do quick run through of the MCQs which I've already done. So it was a form of a revision. Next thing was after that, then I used to read a different topic so that I have two things what I've covered in that duration. Then whenever important thing to understand is even if you made a schedule that I'll read from 9 to 1, I'll not decide I'll read 4 hours, 3 hours, but I'll read for that duration. If you feel fatigue in that, take a break, take some time off, give your time yourself time to freshen up and then sit again. If you continue like you're reading from morning, in between you get tired, you get fatigued, but still you continue that no, I need to complete this topic, you won't be reading that topic efficiently. Whenever you feel fatigue, stop it, take a break and restart. Management of time is very much important in terms that you must, if you even if you go to YouTube, Google, anywhere, you will find that read 50 minutes, 5 or 45, 15 like that. But it is all a very personal perspective. If you can read for 1 hour with efficiency, read, take a break, 5-10 minutes, restart. If you're able to read for 2 hours continuously, read, take a break. And what is important is that, for example, as I told, if I'm reading from morning till afternoon, before starting the next topic in the afternoon, just try to go through or just sit, close your eyes and try to recollect what you have read. What will happen is that multiple times throughout your preparation, you'll be trying to revise and trying to recollect and trying to retain that thing. What will happen is if you're not able to recollect, you know that I need to read this topic again. So next, when you try to read that, concentrate on that thing. So that is how, with managing time, also how to go about the day is also important. So as I told, managing time is also depending on how much time you're getting. And in that time, divide how much you can read efficiently. Don't just blindly, if you are working from morning to evening, don't just blindly go and sit from evening that no, I'll study till night. Definitely not be able to read 100% efficiently. So divide into according to your like your reading capacity and your concentration. And most important thing is that many of us during from our school days to now also, many of you have sent me a query regarding distraction. Now, when does distraction happen is that when you are not able to read or not recollect, or you're not interested in that topic. Whenever you feel bored to read, try to read something interesting or try to solve the MCQs. What will happen is that time duration, when you're feeling bored, you will cover a topic. Your concentration will be regained if you solve the MCQs and then try to read. Because what will happen is if you're feeling bored, you're not in the mood to study, you sit to study, you will definitely, you will be distracted and you will go to either doing social media or watching something or doing any other thing. And other thing, what I personally, it helped me during my preparation was I used to meditate a lot. What it helped me was it helped me in, first of all, it in reducing the stress and anxiety. And it is not doing half an hour, 1 hour, just doing 5-10 minutes whenever you're feeling anxious, whenever you're feeling distracted. Try to meditate. That will definitely and help me a lot during my preparation. And meditation has scientifically been proved to improve your retention. So that is what I would personally advise all of you to definitely try doing meditation minimum once to thrice a day. So also I discussed regarding this, regarding how to study efficiently. First, you need to understand, are you able to just read and remember? Do you need to write certain things? Do you need to speak and prepare? So you need to understand your technique, because some may be able to just have that visual memory, some may be able to just repeat themselves and then they will remember. Some may be practicing writing. You can just write the important points and try to remember. So that is how you can study efficiently. And other thing is that you should be away from all kinds of distraction. It is not good to sit in an environment where there is a lot of noise and everything. That is a very basic thing. Your post MS candidates, so you have already prepared for your MBBS, you have prepared for the entrance in to get admission to post graduation. So to study efficiently, you need to understand that if I sit to study, I can read constantly for half an hour, no problem. Read for half an hour, take break for 5 minutes, restart again. If you can read for 1 hour, read that, take a break, start again. That is how you'll be able to study efficiently. Second thing is, obviously, staying away from social media is very, very important nowadays, because of constant scrolling up and down, we might be having some sort of attention deficit. Because of that, we may not be able to concentrate. So if anybody has a habit of doing a lot of social media, obviously I'll advise you to reduce that. We are not small children now to be said that stop using mobile. We need to reduce it, because also the mobile acts as a relaxation also. But frankly speaking, music, meditation, all of this helps a lot to reduce the distraction and also increasing the efficiency. So that is what my personal advice is. This is whatever I'm telling you today is from my personal experiences, because when you make mistakes, when you go through that phase, you understand how and what you can do better. What even I would have made a lot of mistakes, but I can tell you what not to do. So that is why I'm taking this session today. Main and most important, and many questions or majority of the questions were regarding how to retain and memorize for long. So there are a few things which I think will help you to do this. Is that one is, my personal thing is, or even in my lectures, what I try to do is make you understand things logically. What will happen is that surgery or medicine is a logical thing. Some things you obviously have to mug up, but some things are pretty much very logical. And if you remember it, understand the concept, then automatically you will be able to answer the question and even retain that thing for a longer time. So first thing to understand is, when you are reading, understand the concept logically. Then try to think that this leads to this, leads to this, understand like that. Definitely that topic you will be able to retain for a longer time. Second thing is revision. Some people think that just completion of the course is important, and you do not concentrate on revision, you will never retain or be able to recollect things in the exam. Minimum, my advice for exam is 4 times revision is must. A very thorough once or twice, but if you can try to go through 3 to 4 times, you will be able to retain and memorize. See, what will happen is, try to link something with some, like for example, if there is a concept which can be linked to a surrounding, to a situation, to a world scenario, try to link it, you'll be able to recollect it. Second thing, obviously the mnemonics, try to remember in a mnemonic way. That will help you to retain things. If you, some people are very good at making this mnemonics, that will help them remember for a longer time. Some people can just read once or twice and remember. Some people, as I told, my personal was that I was understanding things conceptually, logically. I used to be able to recollect it more. Other thing is that, for example, if, as I told, if you are making a schedule of 5 day, 2 day, in the 2 days when you have revised that thing, and revision is not like you have read a page, you again read that page. That is not revision. In that page, this is important, this is important, you mark during your first reading, read that. okay, this topic, these points are important. That should be the thing for your revision. Read that during first revision. So when you do the second revision or you just going through second reading, try to recollect what are the points. Okay, these were the points. If you're not able to remember certain points, then read that. Then that memory will always be there for a longer time. And third thing is that memory is always linked with our distractions. If you are distracted a lot, your memory will go down. So you need to be able to concentrate more. So that is how you can retain and memorize for a longer time. It is normal to be distracted while not just revising, but even reading, because we are in such a world with such stress, with so many distractions, not just the surrounding, but even social media. Everything is there are so much content out there that you are bound to get distracted, but it is always up to you to restrict yourself from that. How can you do that? You need to make a habit. Don't try to stop doing things altogether. Try to reduce it first. And if you must have seen Quota Factory, obviously I'm telling you because that is a thing which you can link. Habit becomes in 21 days. If you want to do something, start doing from now. Daily, give yourself boost that yes, I did it today, yes, I did tomorrow, yes, I did day after. Over 21 days, that thing will become a habit, and that is my personal experience, and that does happen, and it is proven. So distraction can be reduced. Don't stop it altogether. Try to reduce it. Automatically, it will get reduced, and you will almost may also stop it. So that is what I would say for this. Then to prepare for final year and NEET SS, what I would say is that uh, if you have read the super specialty books for INICET, then if you are reading from second year, then it will help you. But if not, you are just reading daily Sabiston, then obviously you need to theory for your final year exams, and you need to be able to apply that knowledge for a NEET SSC. It is not different. Only thing is you need to add MCQs if you want to prepare for NEET SS. So if you are very much in, like, now it is obviously open for all, that even final year going students can very easily crack and get a good rank for NEET SS if you are reading your daily Saviston properly now and your concepts are clear. What you need to add is you need to add MCQ practice with both of them. Reading a topic in the day, you have read esophagus, you have a MCQ, read it at the end. And one of the question also have asked regarding MCQ first, topic then, or what, how to do. So one thing is read the theory, be thorough with it, then solve the MCQs. What will it do is it will prepare your mind to solve the MCQs, and also it will help you. If you are able to answer properly, you will be able to have that confidence. Don't try to read the MCQs and then read the topic, because what will happen is if you solve the MCQs first and then you read the topic, you will be reading selectively according to the MCQs. So never do that. Read the theory completely, revise that once, and then solve the MCQs. That will be like your second revision. And don't solve the MCQs like you have solved. If there is some, like for example, our platform has the test, you end the test, you just read through the solution. Don't do that. Solve the test. It will help you to engage your mind in solving the questions. After that, try to work on that. Yes, this topic I thought I was remembering, but you made a mistake in that. That means you need to concentrate on that thing. So that is how you can prepare more efficiently. Read a topic, try to revise it, then solve the MCQs. And only thing is you need more MCQ practice. Read the theory, solve some MCQs. That will help you prepare for both final year and your SS. What books to follow for particular topics? So this is very much important. Nowadays, Bailey Sabiston is pretty much enough to prepare for NEET SS. And what I would advise now, starting with Bailey, whole of Bailey is important. Don't take Bailey for granted. I'll tell you some chapters which you can avoid, but majority of them are important to study. Starting with part 1, part 2, part 3, part 4. All 4 parts are important. Basic principles, pediatric, perioperative care, trauma, Very much important. In trauma, you can just skip the extremity trauma. Orthopedic is not asked. You can skip that. Other than that, orthopedics whole part you can avoid. I have not seen any questions from orthopedic till now. I have almost given pre-NEET SS and I've not seen any questions in that. Coming to skin, plastic reconstructive, very important. Head and neck, cranial surgery, eye orbit you can avoid. In this, only cleft lip and palate. Ear, ENT avoid. Pharynx, larynx, neck, only the neck nodes and the levels of dissection. Oral cavity important, salivary glands important. Endocrine and breast, full important. CTBS, Bailey is enough. Sabiston, very detailed covered. Only few names, but that can be, depends on the luck. If you can answer, then answer. But read from Bailey, Sabiston, you can avoid CTBS. Vascular, GIT, GUT, transplantation, all needs to be read thoroughly. You cannot miss any of these chapters. Skip from Bailey, I told. Elective orthopedics, opthal, ENT can be skipped. And pharynx, larynx can be skipped. Neck, level of lymph nodes and the levels of dissection and the types of dissection, you read that. Sabiston in surgical basic principles 3, 4, 5, 6, and research. These chapters are needed to be covered. 1, 2, and 7 and 8 can be skipped. Perioperative management, you can like just superficially go through geriatrics, but other than that, all are important. Trauma, acute trauma, difficult abdominal wall, burns. This needs to be covered. Whole transplantation, oncology part, soft tissue sarcoma. I'm not seeing any questions, but if you superficial reading is enough for this. Bone tumors not important. Head and neck, as I told, just the neck nodes. Breast, endocrine, esophagus, abdomen, chest you can avoid from Sabiston. I'm not seen any detailed question and you cannot read. It is somewhat complicated also. Vascular and specialty should be read. So this is what I feel is pretty much important to be covered from both Bailey and Sabiston. This I've already covered regarding what to read first, MCQ topic, or how to read and more efficiently. Now, I have almost covered majority of the questions what I felt are needed to be covered. Now I'll take your questions for whoever has joined in the meeting as well as in the YouTube live. Now I'll be taking questions from your end. If you want to ask question, please go ahead. I've covered a lot of things. If you have any queries, please let me know. The few questions what are in the meeting are regarding the general surgery part from Sabiston. So you have to read the chapters which I told from Sabiston, and Bailey is completely needed to be read. And regarding concentrating along with duties, as I told, concentrate on your work. When you get free time while working, try to solve some MCQs or read some topics. But other than that, if you're not able to, don't try hard. After you have finished your duties, when you're free, then study, because that will be more efficient. You cannot do multitasking in reading. You need to read when you are reading and work while you're working. Any more doubts from anybody? I'll be happy to take them. So reading the book and notes, both you need to do. First reading should also always be book. Don't try to read the notes directly. Any notes you have, be it ours or be it any other platform, try to read the textbook first. Make your own notes marking if you are able to do that, and then read the notes, because you'll be able to understand the concept first, and then you will be able to read what you need to remember. If you directly read the notes, it will be more of direct mugging from first step. If you are reading the book, your concepts get cleared, and then you read the notes, then you will be able to retain more. For INICET Gastro for the last 25 days, what I would advise is that if you have read Shackelford and Blumgart, then revise what you have read. Don't read new. If you have not read, then just go through our mock test if you're taken. If any other mock test or any other test you have, go through them. Other than that, concentrate on the general surgery part, specifically the trauma, endocrine, and the vascular disorders, because the questions in the general part from the INICET SS are concentrated on that. So try to cover them. That is what I would advise you, because in last few days, like 15 to 20 days, you cannot read the whole book. If you have some notes, you have read some topics, revise that from Shackelford Blumgart. If you have not read, just read the GIT from Sabiston. That is pretty much will be helpful for you, and concentrate on the general topics which I already told. For the INISS general and minimal invasive, concentrate and read about the laparoscopy, the basic concepts regarding the laparoscopy, regarding the instrumentation, regarding the pressures. Everything needs to be covered in minimal invasive. And other than that, your trauma, the general part, and the GIT from GIT is important for the general and minimally invasive surgery. Because in minimally invasive, some questions you can expect is just regarding the laparoscopy, regarding the basic of instrumentation, the angles, the pressures, the techniques, the length of the instrument, the basic concepts, the anatomy in the laparoscopy, specifically the inguinal canal and the inguinal hernia anatomy in laparoscopy is pretty much very favorite, just both for FET and for the minimally invasive exams. So that is what I would advise you to read. For that, Sage's manual can be read if you are solely preparing for minimally invasive. Any more questions or doubts? No more questions or doubts? I think I've covered a lot of things. Okay, so I hope the session today helps you in planning and preparing more efficiently. If you have any doubts after this session also, please feel to write to me, and you can contact me for any queries. And if needed, even before NEET SS, I'll be again taking some exams. So that is the whole thing behind our platform also, that the tests, the modules, the notes, the mock test for INICET SS, all have been kept in such a way that it helps you to read more efficiently, because we are not keeping a very straightforward test or the material. We are keeping in a way that you can remember conceptually, logically, and it stimulates your brain to think more for how to answer the question than just blankly answering a very straightforward question. So with this, I'll just conclude this session, and thank you all for joining all in the meeting as well as on the YouTube live. So thank you all for joining, and thank you for watching. I hope it helps you. If you have any other queries, doubts, please feel to reach out to me. Thank you so much.